Tell me, what do you know about dosing schedules? Are there any set criteria or concepts to guide to comprehend some great learnings about this particular topic? Well, doubts to this will be thrown out. Let the faith enter. Because our topic for the day is dosing schedules, all about them and the little tidbits too. Welcome all to IS Pharmacology Difficult Podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Let's brush up and revise, or in case you aren't a regular listener, let's get to know few concepts. That'll make you understand better the dosing schedules of different drugs. All in all, pharmacokinetic explanation. Now, the first point in this regard is to start with, let's talk about drugs with extremely short half-life. Extremely short, what do I mean by saying that? I mean, example is dopamine having a half-life of only 5 minutes. Or you can also consider adrenaline having a half-life of around 1 to 2 minutes. Or oxytocin in medium having a half-life of about 3 to 5 minutes. Now you can very well comprehend that these are given by continuous intravenous infusion in order to achieve a steady state plasma concentration. Now some drugs have short half-life, somewhere the units are hanging around half an hour to up to 2 hours. Well, yes, we need examples. Paracetamol having a half-life of around 2 hours and benzyl penicillin having a half-life less than 1 hour. It's just so annoying to administer them every half-life. Well, just imagine that. That's really so annoying. But one way out, I can tell you, yes, I have a solution that with such conditions that the drug, if obeys the first order kinetics, and the drug is also having a very good high safety margin. That means I just simply mean to say that it's a safe drug. Then what you can do is actually increase the dose as to administer the drug every 6 to 8 hourly. Well, remember I told you doubling the dose increases the duration of action with more than one half-life? Just brush up your concepts. We just did it in the last episode, right? Second point, let's talk about the drugs having a half-life between 4 to 12 hours. You can actually administer them every half-life. Yeah, that's not a big deal. That's not annoying at all. They're having a considerable half-life, which is quite easy and quite feasible to follow. Right? Next important point, let's have a chit chat about the drugs with a medium half-life. The medium means somewhere hanging around 12 to 24 hours. Again, if you can administer such drugs every 12 hourly, that's quite a feasible, easy concept to follow. No big deal here too. Now specifically, I want to comment on drugs with 24-hour half-life interval. Yeah, that's an important special thing, so do pay attention. Now, when a drug is having a half-life of about 24 hours, what you can do is to administer the drug every half-life. That won't be a difficult task. And yes, this is going to be very, very clear with that proper apt example. That's truly the need of the moment. Say that the dose of the drug is 100 milligram and the half-life is 24 hours. So what are we going to do? We're going to scale down the dose to 12 hourly, and that is we're going to calculate by simple proportion and administer the drug every 12-hourly interval. In this case, let's quickly get to the calculation so that you understand it very nicely. When we have a therapeutic dose of 100 milligram and the half-life is 24 hours, so the calculation for every 12-hourly gonna be 100 divided by 24 multiplied by 12. That's gonna give 50 milligram dose of the drug should be given every 12-hourly interval. Okay, that was the whole calculation and the concept. We got it very easily. So before I proceed telling you about the drugs with very, very long half-lives, what we're gonna do is let's quickly summarize few bullet points in this particular regard so that we really get our concepts so strong enough that we are not messing up or stumbling up in the future. Just understand the concept. What can we define dosing schedules as? Dosing schedules are nothing but simplified schemes, and their aim is achieving the desired effect and minimizing the adverse effects. What a beautiful definition, right? We just have to get the desired effects, and we don't want any of the side effects, any of the toxic effects. Second important point. What will you define the objectives of a dosing regimen where we need a continuous effect? Yeah, we need a continuous effect. There should be no break. So how will you define such a dosing schedule or dosing regimen? Well, first and foremost is to specify an initial dose. In this particular case, when we need a continuous effect, we need to have an initial dose in hand, and later we want to know about the maintenance dose. And yes, all these gonna be covered in the upcoming episodes. I'm not gonna go in details just now. Now let's talk about the special cases. Yeah, that's the true summary. The first one, when the half-life is 6 to 12 hours. In this particular case, a very satisfactory solution is to replace one half of the initial dose at the interval equal to the half-life. As you all know, dosing every 6 to 12 hours is quite a good, acceptable task. That I told you. Nothing big deal, it's quite a feasible thing. Second important summary point, if the half-life is more than 24 hours. In this instance, if you actually dose it daily, and daily dosing is quite a desirable task and it is needed for a very good patient compliance. And if you give half of the priming dose, don't wonder what the heck is the priming dose. The details will be soon poured upon in the upcoming episodes. Just take it as a teaser, right? So if you're gonna give the half of the priming dose every day, just imagine you are actually entering more of the drug than the amount of the drug that is leaving the body daily. So what gonna be the consequence? If the entry is more and the exit is less, the drug gonna accumulate in the body. It can produce a lot of toxic side effects, right? Now this is a complicated situation. How to resolve it? By simply replacing only a balanced, calculated amount of drug that actually leaves the body in 24 hours. How are you gonna know that amount, that golden number? By calculating this particular value. And how you do it? If you know the values of the initial dose, if you know the value of the dose interval, and you know the half-life of the drug, by knowing these three parameters, you can calculate the right balanced amount that should be administered so that it doesn't accumulate in the body. Okay, that's a quite intelligent aspect. Let's move on to our next point. Now this case is for the drug when the half-life is less than 3 hours. Now just imagine if the half-life is less than 3 hours and you're gonna do the dosing at the intervals equal to the half-life. That's gonna be too frequent. Every 3 hours you're giving the drug? Will you remember giving the drug? Is it feasible? Not at all. So one good solution to go for is a continuous intravenous infusion. Now I'm talking especially when the half-life or the T-half is quite very short. And very good example I've already given you about the dopamine. The half-life is 2 minutes. But what if the half-life is around 90 minutes? The drug being lidocaine. You can give intravenous bolus, and that can be followed by the intravenous infusion. Okay, I gave you both the examples, I gave you both the solutions, so you can really do these feasible things which are not very complicated and easy to go for. Okay, one more reasonably nice effort to do is intermittent drug administration, and that especially I'm talking about the drugs with very, very short half-life. Now, this can work only if the large fluctuations occur in the plasma concentration and you are ready to handle that. Yes, and when you will be ready to handle that? When you are dealing with quite a safe, non-toxic drug. When the drug is having a very high therapeutic index, a quite large enough therapeutic index that you can handle, that you can rely upon, that you can monitor, that you can supervise, and you're confident enough that nothing wrong gonna go. And I know you're thinking of an example. Well, I'll give one. Benzyl penicillin. It's a non-toxic drug. It has a half-life of around 30 minutes. And it is very effectively given in a 6-hourly regimen. And it's very safely given, non-harmingly given. And it attains quite a large plasma concentration as compared to the minimum inhibitory concentration for the sensitive organisms. And that is also, it is achieving such a high grade of plasma concentration not in one time. It is achieving it very, very frequently. See, so you just know, nothing is fixed. Everything depends upon so many factors. Yeah, it really depends upon the drug, upon the half-life, upon the therapeutic index, upon the patient compliance, the nature of the drug, the mechanism of the drug, the pharmacokinetic behavior of the drug, etc., etc. Well, these are some of the important accountable points. Well, the list is too long of the factors that govern the whole total administration of the drug to a patient. I know I've landed upon the highway of the weekend quite strong, and my preachings are actually lengthy enough, maybe more than that can be digested, but no worries, you are all techie smarty people, so tech guidance and knowledge gonna make your audios listening so easy and at your doorstep very, very convenient. But before I depart, please pay heed to my one more talk, as it's really gonna help you. Do listen to this episode very attentively, because that's gonna help you dive and comprehend into the subject, into this topic effectively, thoroughly, enjoyably. Okay, time for wrap up. Seriously. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you are listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.